your gum tissues should not bleed. If your gum tissues are bleeding, you have some sort of infection or inflammation in the mouth that's causing a major problem. Do you know that there are 700 bacteria, fungi, or viruses that we can test for in the oral microbiome? So we need to make sure that our gum tissues stay healthy and that we keep those bad pathogens that can cause inflammation and bleeding at a lower level. Those bacteria not only cause your gums to bleed, but they're connected to heart attack, stroke, diabetes, colorectal cancer. It's tied to rheumatoid arthritis. It's tied to Alzheimer's disease. It's tied to adverse pregnancy outcomes. So your oral health matters. The best way to make sure that you are removing as much of that bacteria and taking care of your oral care is making sure that you're using an electric toothbrush. You have to floss and make sure that you're tongue scraping, and always use a water flosser. We need to make sure that we have good routines in place to help prevent those inflammatory responses that causes gum disease. Gum disease starts with bleeding of the tissues. So if you have gums that are bleeding, make sure that you are bumping up your oral care. Use an electric toothbrush. Make sure you're flossing twice a day, and then use a water flosser to make sure that you're removing as much of the bacteria that causes that inflammatory response. It's not just your oral health, it's also your systemic health.